Essential oils, sometimes called the lifeblood of plants, have been used for thousands of years to promote health and longevity. Today, modern research confirms their value as some of the most powerful natural medicinals. Dr. Gary Young has devoted his life to the production and distillation of therapeutic-grade oils and to exploring their healing potential.
How did Raindrop Technique come to be? Years ago, I had the opportunity to study with some Lakota people, and I was learning about their vision quests and drum ceremonies and just having a wonderful experience in learning. And one evening, while sitting around the campfire, one of the elders in the village started telling me the story of his people and how they used to travel north across the border before there was a border into Saskatchewan and Manitoba. And they would make this trip in the spring, and they would take the entire tribe. And of course, part of it was as they were traveling, they were hunting and gathering food. But their primary reason was to go north to where they could be close to the Aurora Borealis, the northern lights. And those who have heard them, seen them, experienced them, know that they make a lot of noise and hissing and singing sounds, tremendous electrical energy. Well, when they would get to a certain location in the northern provinces of Canada, they would pitch their camps, and they would take these special times and they would go out, they would hold their hands up as the lights were displaying, and they would breathe in that electrical charge and pull it through their fingers. And they'd breathe this down into their body, into their very being, and then mentally they would and push it back up through the spine. And this, they believe, created incredible healing. And it helped them overcome many, many different health compromising problems. And so they practiced this for many, many years. And when the border went in place and they couldn't migrate any longer, then they created a technique, a therapy technique of trying to demonstrate it through light finger stroking up the spine. And they'd have the people stand and hold their hands up. They would breathe while someone would stand behind them and stroke the spine, and they'd breathe in the energy and then they would blow it out. The purpose of blowing out was to force this energy down through the cells of their body. And so when I heard this story and working with electrical energy and energetic medicine and knowing the electrical frequencies and essential oils, I felt that this would just tie together, that it was a beautiful marriage. So I came home and I started experimenting and practicing, and over a decade ago developed what today is called Raindrop Technique. Now I'd like to introduce a colleague and a doctor friend of mine, Dr. Michael Alsop, a chiropractic physician.
Thank you, Gary. It's a privilege to be here as part of this training session on Raindrop Technique. As a chiropractor, I have the privilege to see in action the Raindrop Technique have effect on back patients. Several of my patients have actually canceled their surgeries because the Raindrop Technique removed their symptoms. Raindrop Technique is based on the idea that viruses and bacteria sit along the spine and cause inflammation. These pathogens and that inflammation cause the spine to distort or torque, giving the spine that malformed appearance. As long ago as 1976, research done at the Western General Hospital in Edinburgh, Scotland, concluded that scoliosis can be caused by viruses. In 1981, studies at the University of Bonn, Germany, showed that the varicella zoster virus can lodge in a person's spine for their entire lifetime. 1 year later, in 1982, a research report in the Journal of Bone and Joint Surgery linked scoliosis to oral polio vaccine. More recently, in 1998, studies at the Pasteur Institute in France and supporting research published in the New England Journal of Medicine documented increasing cases of spinal disease caused by the tuberculosis bacteria. In 2001, research from the Royal Orthopaedic Hospital at Birmingham, England, concluded that severe sciatica can be caused by gram-negative bacteria which inflame the spinal area. The essential oils used in the Raindrop Technique have all been proven to be effective against fighting microbes, reducing inflammation, and balancing the body. When coupled with the unique application techniques of the Raindrop process, the results are fantastic.
Raindrop Technique can be customized for the individual needs. It doesn't have to be utilized just for spinal problems or a back injury or back pain. And that's what makes it really special, because you can take an individual condition such as a lung problem or liver problems, pancreatic problems, digestive problems, hormonal problems, and be very specific in understanding how the spinal column is your freeway of nerves that runs throughout the entire body. And so we look at a situation like someone that might have a respiratory infection. Instead of using wintergreen or basil or cypress that's traditionally in the Raindrop technique kit, we would then switch it out and use Ravinsara, Eucalyptus radiata, which are very powerful antimicrobial and anti-infectious oils for the respiratory system. It's important to remember that everyone is bioelectrically and biochemically different, which means that if you're working on someone that has a very similar problem of someone that you had worked on earlier with a similar problem, and you're applying the same oils and you're not getting the same results, take that into consideration, that that person's chemistry is different. How long does an application last? Does it need to be repeated numerous times? I've seen cases where applying the Raindrop technique one time will bring that person into balance and hold them for as long as 5 months. I've seen other cases where applying the oil, it works for a couple of hours and then the problem returns, and particularly in the cases of spinal problems where you've got scoliosis or kyphosis. You've got to remember that when the patient or the person you're working on is lying on the table versus sitting or standing, the torque to the spine is very different. Depends on, in an infection or a body condition of a different type of disease, how old they are, how long they've had that problem. Other areas that can create variances, their pH. The closer their pH happens to be to balance, the more effect it will have. If they're very acidic, it will compromise the effectiveness of the oil. If they're not consuming water, that can compromise the effectiveness of the oil. So the more water, the more they hydrate, the more they'll cleanse and detoxify, because oils are natural cleansing agents. They're trying to reestablish balance. Attitude, exercise, dietary habits, all of these things are extremely important in bringing the body back into balance and maintaining that state of balance. It is so non-aggressive, it's so gentle, it's fun, it's enjoyable, it's invigorating, it's relaxing, and it's something that everyone in the home can learn to do, from your children to grandmothers and grandfathers. Husband and wives can share and exchange doing a Raindrop technique on each other. I have watched for over a decade professionals from chiropractors to osteopaths, medical doctors, naturopaths, physiotherapists applying this technique with profound response and success. And I've seen grandmothers have the same results. It's just a matter of practicing and doing it. The benefits are nothing but spectacular and enjoyable.